People in New Jersey and all over the nation are living longer, and they're living longer with more chronic diseases. And that is something we really need to focus on in healthcare across the spectrum.
The challenges we see for the aging population is the increasing vulnerability we all have to chronic disease as we get older. Medicine has been built on the concept of specialization, and make no mistake, it has led to tremendous advances in the treatment of disease. But chronic disease is a very complex situation, and we're beginning to appreciate the value and the importance of having someone who can control everything that's happening, medically speaking, control everything that's happening and coordinate all these different specialists to, in fact, treat the patient and the family as a whole.
Most of these patients don't have a primary care physician anymore since they can't leave their home. They've got multiple specialists, and each one of those specialists is writing a prescription that perhaps the other specialist doesn't know is being written. So you've got tremendous problems with drug interactions, confusion on when that patient gets into the hospital, takes them out of their own home environment. They end up actually doing worse in many instances. The population that we're caring for is growing tremendously. It's expected to double the number of Medicare recipients by the year 2030 to what we have today. And the ability to take care of them is going to be overwhelming.
Our families do not all live in the same town as they used to. We have parents and children living on different parts of the country, sometimes in different parts of the world. And so the historical framework whereby a family lived in the same community as their parents and could take care of them is changing.
Medicare is saying that we need a better system to measure outcomes, measure patient satisfaction in relationship to the amount of money being spent. They're currently utilizing what we call a fee-for-service model so that every procedure, every doctor visit, every hospitalization gets paid on an activity basis. And that payment model needs to change.
Right now, Medicare costs America roughly $500 billion. By 2040, that's going to grow to over $1 trillion. It's going to be $3 to $4 of every $100 in our economy are going to go just to pay for Medicare.
The direction that healthcare is taking is really up in the air at this point.
I think that everyone is rethinking the way that they collaborate. We used to be in healthcare in silos, where there's hospitals in one area and then post-acute care providers, even within their own silos in the post-acute care world. And so I see people trying all different models. There's not a one-size-fits-all approach. It really is what's best for each individual entity. In the hospital world, we're seeing mergers, but we're also seeing partnerships with institutions among acute care hospitals, and we are seeing more hospitals reach out to their brethren in the post-acute care world to, again, provide the best care in the most cost-effective setting and meet the needs of the patient.
We have to train many more primary care specialists. We have to develop new kinds of support staff. We have to teach them skills in terms of working together in teams. No one can do it alone. And that requires us to think differently than ever before. And that requires us to collaborate with important providers such as home care, and in our case, the VNA. Hospitals can do certain things in the acute care setting, but without that continuous care that brings in what happens in the home environment, we're oftentimes just putting out fires.
We see post-acute care as a way to partner to prevent avoidable hospital readmissions, to provide care in the home, in the community, where frankly people want to be. They don't want to be in an acute care hospital.
Collaborations are important because you bring the best and brightest together to develop the best patient care plan. This is very important for the future of healthcare.
The Advanced Care Institute holds the promise of finding a new way to deal with particularly fragile senior patients. the type of patient that doesn't do well when they're institutionalized, when they're hospitalized. It's a new focus, it's a new skill, it's a new perspective being brought into the healthcare team. And this is the sort of innovation we need to see to deal with the challenges of the elderly and the growing elderly population.
I'm the director of the Advanced Care Institute. To me, it's the most exciting thing I've had in the last 20 years to begin to work on at this point. This is really a think tank of looking at how we're going to continue to take care of this sick elderly population moving forward. So we've been able to take some of the best people in their fields and get them together to work on brainstorming about how do we visualize patient care for that chronically ill patient going forward.
It makes sense for VNA to launch the Advanced Care Institute because VNA has many touch points in the community. I think VNA is the matrix sort of that will have the technology piece, the administrative piece, the staff, and most of all, its community presence as a nonprofit organization for the last 100 years.
Here at VNA, we use a team approach for our palliative care patient as well as to all of our home care patients. And what that means is not only the patient, but the patient and family. We address the needs of both, and we do this by a very diverse, highly qualified team. We allow our elderly to reminisce, to look back, to think what was positive, and help them transition to end of life in a much more easier, comfortable way.
The history is particularly strong in the area of partnerships with physicians and hospitals. VNA has formed a number of joint ventures and other collaborative relationships with hospitals, with medical practices, so that we work as a team in helping people with serious illness succeed at home and in the community.
VNA is very special because it has a very strong tradition of service and treating vulnerable population, whether it is elderly or young mothers or students or people in the community at the community health centers. It has a large amount of services that it offers under the same roof.
There's always been this commitment to trying to find out the next best way to do things, the next best way to provide nursing services, the next best way to do home care and hospice. There's been a steady growth in the use of technology in the work that we do. There's been an open-mindedness around what types of interdisciplinary professionals should be around the team.
I know that VNA Central New Jersey is a top-notch post-acute care provider. It seems to me that it is burgeoning and growing, and one of the most innovative entities that I've seen in the state of New Jersey, with all of the new institutes being formed and partnerships, which I think is so exciting. A lot of people are in the acute care world are merging, and that may be right for them, but there are other models to be tried, and what I see VNA Central Jersey doing is very innovative.
The visiting physician program is a central part of the Advanced Care Institute because the visiting physician services, that in-home primary medical care program, is an important tool for families and individuals that want to stay home even though they've got serious medical problems. Maybe they can't even leave the home to get regular medical care. They're so debilitated, but by bringing the medical office to their home, it means that they don't have to leave the comfort of their home.
Over the past 2 years, I've gotten to know Dr. Landers, and we've met on many occasions and compared notes about house call practices and the home care industry. Through those conversations, his vision of where senior care and advanced care needs to go became more and more clear. And I think when you put my ideas together with his ideas, I think it's going to be really a spectacular outcome that's going to surprise a lot of people.
Now, the other The other side of the Institute, if you will, the other aspect of the Institute in addition to the home-based primary care is palliative care. Palliative care are systems and supports that help address people's needs when they have serious illness. There's a big focus on symptom management and making sure that pain and breathlessness and confusion and other upsetting symptoms of serious illness are addressed. That's what healthcare was all about from the beginning, is making sure that people knew that they weren't alone and that they were tended to. And I think that the future, we're going to see more of that. That certainly people being cared for by the VNA, our Advanced Care Institute, and those programs are going to feel well cared for. That's the whole point of this institute that we're trying to put together, is to really make sure that we're working as a team. We need the whole team together, oriented around the goals and needs of the patients. And if we can do that, then not only are costs going to be more manageable, and that's going to be an important win for the public, but also the outcomes are going to be better. And the experience, the care experience, is going to be better for people, and that's important.
I think the goals of the Institute are in alignment with general healthcare goals, and that is to improve accessibility to healthcare, to improve outcomes that the patients are going to experience, and to improve the cost effectiveness. And I think the Institute and Visiting Physician Services will do an excellent job of that. If the Visiting Physician Services and the Institute can avert one hospitalization per patient per year, those numbers are in the millions of dollars of money that we would be saving.
Utilizing information technology and an electronic health record, we're going to be able to finally really gather up qualitative and quantitative data that will show outcomes and quality measures for these patients that we can measure actually, rather than it be anecdotal. Being able to have those numbers will give us the ability to argue that some of the resources be shifted towards the home care arena rather than the current direction, which is for large hospital systems to really be where the bulk of the Medicare dollar is being spent.
There's tremendous opportunity for innovation. This whole model is innovative in and of itself. We will be able to reach more patients. We will be able to be more accessible by those patients. We'll be able to coordinate care more efficiently with those patients. So innovation is going to play a key role going forward.
To be able to have brought together Dr. Salisbury and Visiting Physician Services, to have been able to recruit Dr. Sharma into the Advanced Care Institute, to be able to start our work with the Medicare Choices demonstration. None of this would be possible without the generosity of individuals in the community, without the generosity from foundations that have supported our work to date.
Supporting the direction we're trying to go with the Advanced Care Institute in the long run is going to benefit all of us, in that we're going to be able to look at what's effective, what isn't effective, how to utilize limited resources for a growing population. Most Americans, if you were to ask them, would like to die at home, but less than 1 in 4 actually does, despite that being their wish. We'd like them to be able to make some decisions about how they live, and that's really the goal.
This, I believe, is an important cause. We're not only trying to make sure that there's compassionate care in our communities, but we're also trying to do it in a very responsible way that meets the needs of the healthcare system as a whole. We're trying to solve one of the biggest problems faced by our country. It's not just in the healthcare system. This is a major national issue. It's healthcare for an aging population, and we're working to be a solution, and we need help. It's essential that we have support for the people, for the technology, so that we can continue to improve and grow these services. So I ask you really to consider supporting the Advanced Care Institute. I think that you'll be proud of doing that. This is going to be something that's going to make an incredible difference, and it'll be something that you and the community can feel great about for many years to come.